In order to perform scar release on both yourself or a client, first you must position and expose the scar so you can touch the skin and be able to ground. You take 2 units because you must simultaneously treat on each side of the scar. The polarity is very simple. 1 unit is on negative, but the second unit you need to place on the positive negative. So it does not matter which side is positive, negative, or negative. It does not matter. The object is the current's going to go from the tip here to this unit and force back. So there's a sewing needle or ping pong effect electrically going through the scar. With my thumbs on the ground plate, I will roll the wheel forward in order to activate and turn the unit on. You notice there are 2 green lights beside the ground plate which allow you, they're indicator lights, to help you determine where the optimal point is. What I will do is start, and it doesn't matter which end you start, roughly about 1/4 inch on each side of the scar. I will hold the units so I can see the point finding, but you also hear it. I will find one point on one end of the scar, one on the other, and with both lights off on the units, I will, in the pitch high, I will press and hold both units simultaneously. At this time, the current is going from the one I'm shaking to the other one and back to the one I'm shaking. I will hold this roughly 30 seconds per segment. And what I will do when I'm finished, I will stop pressing the buttons, which I'm pressing here, and I will move to the next spot roughly about 1/4 inch away. An easy way to be able to identify the optimal spots to treat is just to follow the staples or surgical stitching that you have. If you do not have identifiable surgical stitching, then if you're in Canada or around the world, you go every 1/2 to 1 centimeter. If United States, roughly every 1/4 inch should be sufficient. While I'm treating, I can roll the wheels forward to increase the intensity of the stimulation, but it is not necessary. Normally, the lower stimulations actually produce better outcomes. I will slowly make my way down the scar. I will not rush this. In order for these 2 units to engage, what they are doing is increasing metabolism and decreasing the fibrous tissue. So give it a few seconds to be able to engage and treat. If you hold it for longer than 30 seconds, you're completely sufficient, and that's okay also. I'm going to go to the next point, and I'm simply going to work my way all the way up the scar. And since you are self-treating, if you are self-treating, take your time and you can go longer than 30 seconds. Most certainly, you are worth it. If you're treating a patient and time is the constraints, then I would rather you do 20 to 30 seconds and sweep the whole scar than just do half a scar. As I'm treating, you notice that the one unit that's on positive negative behaves differently than the unit on negative. That's simply because the electrical current coming from the one that's on positive negative is different, and therefore it will beep in a different mode and in a different period. In order to treat the entire scar on yourself, should take between 10 to 15 minutes. Optimally to do it is to treat the scar at least 3 sweeps. So I'm almost finished one sweep.
Let's say
In this particular area right now, as I'm self-treating, this area below my umbilicus is numb. So probably because of the surgery, I can allow an extra time on this spot to help increase metabolism, which would decrease the numbness. It's not a particularly difficult technique. However, it does require concentration and patience.
Yeah, of course.
Now, a good indication is we're getting close to the umbilicus, which is a sort of one of the few areas of the body we have to be careful of. Not because it's dangerous, but in traditional Chinese medicine, it is forbidden to treat the umbilicus. And we will honor and respect the traditions of traditional Chinese medicine. So I would never treat inside the umbilicus. But in this case, the scar went right up to my umbilicus. So I will use the negative polarity I will place on top of the scar and the positive negative on the bottom. This is forcing the current to loop in this direction. So after I've swept the scar, I wish to plug both ends, but in case that I'm working around the umbilicus, I want to make sure that the direction of the current flow flows away.
MPS therapy.com.
The sensation the patient will receive while self-treatment, some of the points around the scar will feel a little pinpricky or a little bitey, but it is not an unpleasant stimulation. Maybe a slight irritant on some of the points, but it is certainly therapeutically beneficial. After I have treated the entire length of the scar, plug the ends, I'm going to continue downward, plug the ends, and then continue upward again. Plug the ends. No matter where the scar is, we always treat the length of the scar, plug the ends, treat the length of the scar, plug the ends, treat the length of the scar, and then plug the ends. We do this process 3 times, and what you will know is each time you sweep, the relief and the effect gets deeper and deeper and deeper. Essentially, after you apply this 3 times, plug the end 3 times, you're finished with scar release, and if you get up afterwards, you'll notice that the scar is much more pliable, and that parts of the body of your body which may have been restricted before have now freed up because the scar will release the fascia and calm down the nervous system.